Greetings to everyone, my name is Kok ISM and my matrix code number is SB20099. And look at my bag. Today I want to present my poster, which is the introduction to ergonomic hazard. What we know about ergonomic hazard is about the risk and also the hazard that we can be cause injuries and also accidents through wear and tear by doing our daily life activities. So the definition is there. It means it's a type of hazard which include improperly designed tools. Improperly designed tools means that the machinery works and also some of the equipments or even sharp equipments that may causing us or workers to having injuries and also accidents. And work areas means that like construction areas, working areas, offices and other places relevant to ergonomic hazard. This hazard may pose to injuries such as back pain, muscle pain, skeletal pain, and so on. These injuries can be caused by the ergonomic hazard to the musculoskeletal system. This musculoskeletal system can be affected by the ergonomic hazard to be considered as one of disorder, which means that the musculoskeletal disorder. This disorder also means that it's more affect to the musculoskeletal and also nervous system. Next, we look at the types of ergonomic hazard. Before we proceed to this one, we proceed to the types of ergonomic hazard, which is firstly the physical, secondly is the cognitive, and the third thing is the organizational ergonomic hazard. And then the first thing is the physical ergonomic hazard is more relevant to physical and physiological workloads. Like for example, when you want to do something or you want to carry things, this is considered as one of the physical ergonomic hazard. And this physical can also affect to our body system such as the muscle pain and so on. But whereas for the cognitive ergonomic hazard is also another type which involves our mental ability and also our visual condition, such as mental processes and capacities that given by the for example, my boss want to give me a job but I can't remember so much, and if keep forcing me to ask me to remember and then keep scolding me and you can't avoid it. So this is also considered as the cognitive ergonomic hazard. The third thing is about the organizational ergonomic hazard, which means that the boss didn't give the works properly and then simply give to the workers and they has to suffer all of the works and then they can't afford it at all. So this is not arranged very well and this is not non-organized, and this causing the organizational structures, policies and processes to be having a bad texture and giving bad image to the company, and also giving more complaints too. Next is about the injuries. Injuries can be considered as several, but here I'm giving three of them. Firstly is about lifting, second thing is catching, and the third thing is about the office. About the lifting, it's because due to the improper lifting or reaching, such as when you want to carry an object, then you show a bad posture, and this will causing us to hunch when we are getting older. Secondly is about this injury will be affected by to the body system, such as back, like our spinal cord, neck, and also shoulders. This is more relevant to the lift workers and also weightlifter and so on. Secondly is about the catching injuries. Catching injuries is more about when you want to get an object in your higher and the object is quite heavy and not balanced, and this will causing us to get by catching injuries. This is caused by overstretched muscular system, and when you want to take an object, right, you want to land your hand like that, and then this will causing here the muscular pain, the wrist pain. And then this will also get struck or caught by heavy objects such as when you want to bend your leg like that and you want to get something from the high to low, and then this will cause this getting struck, and this is what we call catching injuries. Next is about the office injuries. It is more on to the workers and also the clerks when they are facing to just the computer, and then they have their improper sitting position because of the chair and also the computer. They don't have the bad posture of doing it, and then causing their back pain because of long facing the computer, right? Poor visual condition is also another fact that caused by the office injuries, because when we are just looking at the computer just for even for 12 hours a day in the office, and then because they didn't didn't have take enough rest, and then causing their eyes to be much more blurred, and their vision will be causing them to be more distracted. This will cause of these injuries, and the others too, but I won't further explain that. And last but not least, we can go to see the occupation. Occupation more relevant to the bioergonomic hazard. Firstly, is about engineer. Engineer is more commonly happen to the ergonomic hazard, such as when you want to carry something, right? Like the tractor wants to lift the metal or ceramics, but because of too much ceramics and metals that imbalanced, and then might be falling down, and then because maybe get accident to the workers, and this will cause ergonomic hazard. Next is about lift workers. This is also a very common occupation that will cause ergonomic hazard. Doctor will also too, because doctors want to treat the patients very well by hunching them, and then because of the rushing of patients, they want to save lives and more. So because doctors, it can be also another fact that will cause ergonomic hazard. Clapping can be also another common too. Firefighters, farmers, industrial workers, technicians, and so on. Now, so these are the samples of the occupations that will be causing this hazard to happen. So this is my overall brief introduction for my ergonomic hazard, and hopefully you guys will understand my poster here, and thank you for lending your ears. So thank you.